Hi, this is Dr. Roy Kim, and I am here with Dr. Lee,
Hi.
my awesome visitor who's a plastic surgeon from Singapore. So she's here for whatever reason, hanging out with me. I have no idea why. She's trying to learn stuff. I'm not teaching her that much stuff, but I do have some questions about Singapore and specifically Singapore plastic surgery. And I did learn some things, so we're going to exchange, have a little Q&A and answer those questions. So first off, you are board certified. What I found interesting is that your educational systems is excellent, but you actually rely on the questions from the American Board of Plastic Surgery and the residency review committee and all this other stuff. Is that correct?
Yes.
Okay.
We do the ASPS question.
Yes. So, for everybody in ASPS, whoever's on the committee making questions, I mean, you probably already know this, but it's a worldwide phenomenon.
Yes.
Okay. And then the training is very similar to the US.
It's very similar.
Yeah. You go to med school, then you do plastic surgery training, then you're boarded in Singapore. So, one question I had was in terms of surgery, when you operate, what I found is that in the US, you have a scrub tech, you have a circulator. So you have a scrub tech, possibly even a plastic surgeon training assist you. In Singapore, in your clinic, who do you have assisting you?
In the office-based
In office-based outpatient procedures.
You potentially have a nurse. Otherwise, you're on your own.
Yo-yo, Y-O-Y-O, you're on your own. So I would actually welcome that for the most part. Maybe sometimes I wouldn't, but you literally do a procedure by yourself. And so no one's there to retract or hold things.
For certain parts of the procedure, you may get a nurse to help you.
Okay. And then in terms of breast and body, I know it's less popular in Asia, but what are the more popular procedures?
Breast augmentation, fat grafting to the breast, tummy tucks, liposuction, I think very similar.
Okay. And then in Singapore, what's interesting to me as well is that the breast implant manufacturers are actually limited. So actually in Asia and the rest of the world, you can get typically dozens of different manufacturers of breast implants. And in America, there are actually very few makers that are FDA approved for cosmetic use or even reconstructive use in breast augmentation, breast surgery. What are the manufacturers in Singapore?
So we have Mentor as well as Motiva.
And you don't have Allergan?
Since 2019.
That's right. So Mentor and Allergan are both available in the U.S. Sientra is available in the U.S., but you don't have it in Singapore. And we don't have Motiva. Motiva is pretty, it's a growing company. It's based in Costa Rica, and it's fairly popular. But we don't have Motiva implants FDA approved for wide use yet. Now, how common is it to use the Motiva? The Motiva makes an implant that has a microchip in it. How common is that in Singapore?
It's very common in the cosmetic aspect. Yeah.
So I think it's a little weird that they could scan something and your microchip, whatever. But it's just a little strange to me. But it's sort of cool because you always know the information about that implant, which I think is key. So right now we're relying on mailing in a card or giving the patient some medical record or having the company track it. But if it's on a microchip, hey, you know what it is.
Yeah.
Okay. In terms of face technology, or actually not just face technology, but any sort of technology in the operating room, what is growing in Singapore?
I think facial fat grafting. Of course, surgical facelift is still a little bit less popular. But definitely upper blepharoplasties, lower blepharoplasties and rhinoplasties are common.
In Asia, when you do a rhinoplasty, it's very common to augment the dorsum. In other words, in Asia, a lot of people have a flattish nose, so you want to bring it forward. And so typically that's either a silicone nasal implant or it's actually bone. So what is the more common preference in Singapore?
I think it depends on the patient, but more and more people are into thread lifts for the nose.
Oh, really?
Because they view it as less invasive. It's an office-based procedure, and it's probably cheaper than a surgical procedure.
I'm surprised by that answer because threads work, but they're very short-acting.
Yeah.
And I'm also surprised because does it really augment that much in the nose or not really?
Not really. But I think this is a very consumer-driven industry.
I see. Okay.
Of course, as a plastic surgeon, we would still prefer open rhinoplasty.
Yes. And then we would strongly prefer to use autogenous material, in other words, your own bone and cartilage as opposed to silicone nasal implant. In the U.S., we're fortunate. We're able to get fresh frozen rib graft. Do you have it as well?
Yeah, we do get that as well.
Oh, that's good. That's good. So that's really great advantage because some patients may not have quite enough cartilage to get the best result.
Yeah.
So
Or an unnecessary scar.
unnecessary scar. It's a tiny scar around the 7th rib. Come on. It's not that big a deal. So anyway, okay, it's another scar. Do you have any questions for me about plastic surgery?
Yes, what's your favorite procedure?
I have two favorite procedures. One is breast augmentation. The other one is facelift/neck lift. So those are my two favorite procedures. So any other questions at all?
And how old are you?
I knew this was going to happen. I don't know why people are curious about my age. So if you stalk me, you can figure it out based on when I was educated or not. And
Because you look so young.
I'm 110, but with all the cosmetic, non-invasive procedures I've had, I mean, I look younger. What else? The other thing is that I did train in the 20th century. So I trained a long time ago. So that should give you an indication of my age. Almost retirement age. So there you go.
I'll do some calculations later.
Okay. Do you have any other questions?
It's very nice for you to look after us.
Oh, well, thanks for coming by. And then, how do you say goodbye in Mandarin?
再见.
That's it?
Yeah.
And I'm going to mispronounce it. We usually say goodbye, so that means the same thing. 再.
再.
Oh, man.
再见 actually means
再见. What does?
see you again.
But we may not see you again. Maybe they click off this video and they don't want to see us again. Okay. And 再见.